Welcome to Business Today. I'm Siddharth Zarabi, and with me, kicking off Thursday's conversations here at the World Economic Forum in Davos is Shyam Bishen, the head of the Center for Health and Healthcare and a member of the Executive Committee of the WEF. Shyam, morning, welcome. I want to dive straight into a news point that a lot of people want to understand in terms of the impact. How will the withdrawal of the United States of America from the World Health Organization impact public health across the globe? Is there going to be an impact?
Absolutely. And first of all, good morning, Siddharth, and thanks for having me on your program. Absolutely. I mean, this is going to have a huge impact on global health, on public health across the globe, especially on low and middle income countries. So this is an unfortunate situation. We are hoping that we will still, change some minds here, whereby the funding for global health, not just the WHO, but others as well, whether it's a PEPFAR or it's USAID, they have a lot of funding going to global health side, and all of that is on hold right now. The payments are frozen right now by US government. So it's a matter of concern. It's a matter of grave concern, and we have been having many discussions in this area, how to respond to this over the last few days.
In the case it remains unresolved, is there adverse impact that you see on global health priorities, particularly in regions of the globe where this is very, very significant public health initiatives because of the kind of economy they have?
Yes, yeah. So we see an impact on preparedness for emergencies, whether it's a climate change related emergencies, extreme weather events, global warming, on the pandemic side as well. The funding from US to WHO obviously helps on the public health side to prepare for some of these emergencies and respond in those emergencies. So I think for developing countries, for LMICs, this will create a big challenge.
Let's move on from here because the situation will pan out in the weeks and months ahead.
Yes.
But currently, and I remember having a conversation with you right after the first forum event post-COVID.
Yes.
From then to now, what has changed, and in terms of the preparedness of the global health system to respond to any future health emergency, how are we placed?
Yes, I think we are making some good progress here, but we are still not fully prepared. I think we still have a long way to go. There are a few areas where we are working on with both public and private sectors. So we are working with G20, we are working with many of the big pharmaceutical and healthcare companies to see how we can create a better disease surveillance system, better disease intelligence system, whereby we can monitor pathogens, we can monitor viruses early on. You know, the outbreaks will happen. Yep. The way we live, we are destroying biodiversity, the climate change and everything, is impacting new pathogens and new viruses will emerge. So those will happen. The idea is to catch them early on, catch them, in a very early outbreak state, so that we can stop them from becoming full-blown pandemics. So we are working on a global disease intelligence, global disease surveillance system, together with the governments and together with the private sector. I think private sector has a big role to play here. It can't just be done by the public sector. So we are bringing those two together. So that's one area. The other area is on the manufacturing side. We want to make sure that there is local, regional vaccine manufacturing, regional diagnostic manufacturing across the world, so that in case of a pandemic, if governments come up with their own ban across border movement of goods, we are still prepared to provide vaccines, diagnostics to populations around the world. So I think some work has progressed in this area, but a lot of funding and a lot of collaboration is required, international collaboration is required here to take it to the next level.
What are the slow burn health problems, challenges that are perhaps still being underestimated?
I think we underestimate the impact of climate change on human health. Most people think that it's coming, it's 5 years, 10 years, 20 years from now, but no, it's here.
It's upon us.
It's upon us. You see the impact of, air pollution, for example, and we saw that in Delhi, which is still ongoing, where the air quality is really poor, and this is because of the climate change. Obviously some of it is man-made, but a lot of it is, because of the pollution that we have been causing over the, last several decades. Some of it is acute, some of it is chronic, So how do we respond to something like that? How do we respond to extreme weather events, and as well as on the global warming side? All the disease areas, vector-borne diseases, infectious diseases, respiratory because of the poor air quality, cancer, cardiovascular, they are all going up. We need to make sure not only we look at the mitigation strategies to lower the carbon emission, but we also look at the adaptation strategies. And the forum is working again with both public and private sector to do that, so that we bring the light, we shine light on adaptation strategies, we shine light on preparing the health system to respond to some of these challenges that climate change is posing.
Let me turn to one of the more exciting developments that's been panning out over the recent past, and this is artificial intelligence. I was quite struck by this announcement that there's a new supercomputer that will use artificial intelligence in the United Kingdom to develop new drugs and vaccines, and I believe that it's going to be operational very soon, and this is going to be the most powerful supercomputer in the United Kingdom. How significant is this from a point of view of fighting disease?
I think it's quite significant. I think using artificial intelligence, we can lower the time that it takes to bring a drug to the market, from discovery to clinical development to the launch. The drug discovery costs about $2 billion, and north of that. It takes 8 to 12 years to bring a drug to market. With AI, we can do it faster. Drug discovery, already we have a few drugs that are in clinical trials that were discovered from an artificial intelligence use. So I think the use of supercomputers will further accelerate drug discovery process, and hopefully we can also use AI in the clinical development and can reduce the overall time that it takes to recruit patients, overall time it takes to conduct the 3 phases of clinical development. That Dr. Demis Hassabis got Nobel Prize for use of AI on protein folding, which is again directly related to drug discovery. So I think all of these areas are very exciting, and we are super thrilled to see the development here.
We had a fast-track development of a major kind after COVID, which is the COVID vaccines that we got. It was fast-tracked than usual.
Yeah.
I just wonder, had AI been around, how faster would have that been rolled out?
Yeah. AI would have certainly helped us on the delivery side. I think on the development side, it was quite fast, as you said. It took us 10 months from the time we identified the pathogen genomics to come up with a vaccine.
Would AI have crunched that 10
AI
months
may have crunched that by a few months, but 10 months is still very, very fast. And that's a great example of international public-private partnership, international collaboration. But AI would have certainly helped us on the distribution and delivery side of these vaccines, getting these to the last mile, getting these to the low and middle income countries faster.
In the Indian context, and considering the disease burden that we have, and the kinds of sort of diseases that significant number of Indians face, what role can AI play, and what should policymakers be doing to deal with that? Because it's a big cost for the exchequer, it's a big cost for individuals. India remains an under-penetrated market when it comes to medical insurance. There is the state has limited capabilities. How can India leverage AI as far as fighting the disease burden is concerned?
No, I think that India is in a really great position to leverage digital technologies, including AI. India has good infrastructure, has made some excellent progress in that area. Ayushman Bharat Digital Mission Program, Ayushman Bharat Health Account programs. All of these are great infrastructure, that already exists there. So I think using that infrastructure, private sector can bring innovation faster, and private sector can work with public sector to bring new innovative ideas when it comes to digital health, when it comes to tackling some of the disease burden that you have in India, both communicable as well as non-communicable diseases. As you know, the non-communicable diseases such as diabetes and cardiovascular diseases are growing very fast in India. Obviously, tuberculosis and other communicable diseases are still there. Antimicrobial resistance is still a big problem.
Significant issue, absolutely.
Significant issue. And we believe AI is already being used. For example, they are using AI now to just analyze your breath. And from that you can tell whether you have tuberculosis or not, whether you have any kind of drug resistance tuberculosis or not. So it's being used, but I think AI can further accelerate that.
And can it also help address the issue of affordability, particularly in the Indian context, or for example in the African continent? There are issues around affordability also, not just delivery or development. It's also about affordability at the end point.
Yes.
Do you think that can also play a role?
Yeah, absolutely, absolutely. I think that's what we are looking at, that how can AI democratize overall health delivery. So we talked about the use of AI to lower the cost of drug development. And once you lower the cost of drug discovery and development, obviously that impacts your prices. You will have lower prices, hopefully. But also on the delivery side, AI can be a big help, not just delivery, but diagnostic side. You know, it's being used on the telemedicine side, on the telehealth side. The Government of India has the e-Sanjeevani program through which they are reaching, hundreds of millions of people, and AI can further accelerate that. So I think there is a huge opportunity here to scale up use of AI and do it in a cost-effective manner. And I think that, again, going back to India's public health, public digital health infrastructure, that is a big plus here. I just wrote an article with Shobhana Kamineni, the chairperson of Apollo Hospital, just on this topic, that how India can show the way here to the rest of the world in using AI, using breakthrough digital technologies to democratize healthcare.
And you're absolutely right, because India has experience of not only doing similar projects at scale, but also at far significantly lower costs. And the India stack is the foundation on which all of this could be built. Shyam Bishen, thank you very much for your time with us today.
Thank you.
This Thursday morning. With that, it's a wrap on our first session of the day here from the studios. We'll continue to get you more guests through the day. Do stay tuned in. Bye-bye.
Hello and welcome.